Lightsabers? Therapy laser? What? Find out more on Tales from the Road next.
It's not really veterinarians in space. It just sounds that way. Wow, what are we going to be talking about today?
Today we're going to be talking about therapeutic laser.
Okay, and what exactly is a therapeutic laser?
Yeah.
I mean, is this a cutting type of thing?
No, it's not a cutting thing. We're not taking over the world. You know, Austin Powers won't appear, nothing like that. No, it's actually a really neat and exciting form of therapy that we have in our toolbox. And basically what laser therapy is, it's something that you may also hear called cold laser therapy. It's not a cutting laser, but it's actually a therapeutic laser which penetrates into tissues. And it has this really neat action. It's called photobiomodulation, which is your cool doctor word of the day. But what it really means is that light waves of a specific wavelength will affect different reactions in your body.
Okay. So does the skin have to be exposed? I mean, how does this work?
How does it work? Well, it's like probably the most common, most well-known sort of photobiomodulation is actually happens in our own skin. And so when you go outside on a sunny day and the UV radiation from the sunlight hits your skin, you make vitamin D. And I think a lot of people know, that exists. And so this is very similar. So we're not making vitamin D. There's actually a whole nother set of cellular actions that happen with a therapy laser. But basically what happens is this laser light comes in at a very specific wavelength and it penetrates into those deep tissues and it makes those cells in your deep tissues do certain things. Particularly it helps decrease inflammation and it helps take away pain because it's taking away inflammation. And it also actually changes a little bit the way the nerve fibers send their pain messages down there. It clears out garbage. It promotes blood flow to come into the area. And if we have more blood flow, we have more healing cells and better healing come in there. So we use it for a lot of stuff.
Yeah. So how is this different from just a heating pad that you might apply?
Sure.
If you can hold the animal still long enough to apply the heating pad.
Right. Well, it's very different from a heating pad because we're not actually using the laser for its heat. Now it does get hot. If you left it in one place, just like a hair dryer, it would get hot in that area. But we're actually using it for the wavelength of light itself. So it's not so much a heat thing as it is an actual the beauty of live running. Gravity is working. It's okay. No one's going to go flying off into space today with their laser. But what it is, it's actually working at a chemical level in the cells. So it's not just
what
heat.
is it? What sorts of application? What is it good for?
What is it good for?
What illness?
Oh, for so many things. Basically, anything that we have that's going on that causes pain or inflammation, we can use it on. So probably the most common thing we use it on is going to be arthritis. In chronic pain with arthritis and that type of thing. But we'll use it on really bad skin lesions, wounds, injuries, fractures, post-surgically. We use it for really bad ear infections. We can use it for really bad gingivitis. Lots and lots of things.
That your dog,
yeah, anything that ends in itis, we can use. So any itis.
It's the itis cure.
Yeah, or any itis or any anything that has pain or wound.
So why do you use this as opposed to other types of treatment?
Well, a lot of times we use it with other types of treatment. So it doesn't always stand alone by itself. But the reason that that we use it and that it's in our toolbox is that it is very effective, and it is at controlling those pain and inflammation. It's not a medication, so we don't have to worry really about it having a lot of like drug interactions or allergic responses or anything like that. And it's not invasive, and it doesn't hurt. And so especially for a patient who, a lot of us are trying to find ways to, maybe get off of medications and, do more natural routes for things. And that's a good thing. And so this allows us to do that because it's basically taking all the body's processes that it's trying to do and it makes them work better, or it stimulates them to happen. And so it's really making things that your body wants to do anyway work.
Okay. So what does this look like when you
What does
do
it
you
look
have
like?
to shave the animal, or
No, you don't have to
Yeah.
shave them. Actually, we have a picture of what it looks like to have laser therapy. It is, you do have to wear protective eyewear. It's a class 4 laser.
So the dog
and so
okay,
the,
I
and
see 'em
the
there.
animals have to wear
Yeah.
protective eyewear too. But basically, what you'll see is it looks like almost like a little wand, and it's attached onto a big long fiber optic cord. And you have to go over the area that you're treating and kind of the surrounding tissues. And it basically is sort of like sort of the same pattern as if you were using like a spray painter. And so you got to go back and forth nice and slowly over the area, and you do it in as many directions as you can and from as many angles into the joint. So let's say if you were going to do an ankle, you wouldn't just do the outside, you would do all the way around. So you can hit all the cells from as many directions as possible.
So you know, I have to ask the engineer question here. I mean,
Yes.
what sorts of power, what levels of power, and how long is the treatment, and how do you know what's safe for a particular animal size?
Right. Well, it's the dosing of a therapy laser is measured in joules, which is basically just a function of your power over time, your watts over time. And so it depends a little bit on which class laser is being used. The class 3 lasers don't have as high as wattage, so they take longer to deliver the same dose. The class 4s have higher power, so you can get them done in less time, which is really kind of the main benefit to that. So it'll depend a little bit on which class of laser you're using. But we basically figure out the surface area of what we need to treat, and then depending on if we're doing something superficial or something deep, in like say a joint, then that changes how many joules we have to use over that surface area.
Right.
And if they have dark skin or light skin, or if they have black hair or white hair, or if they're very heavy or if they're very thin, because all of those things affect how much energy is absorbed and wasted and how much actually gets down to the target tissue.
So a laser pointer that you might have from an
Right.
office supply store would be in milliwatts. Here, are you talking about
Right. So we're talking like a class 4 laser will go up to about 12 watts.
up to about 12
Yeah.
watts? So
You don't look at it in your eye. Yeah.
Now you mentioned this professional sports teams will use this
Yeah,
kind of therapy,
yeah, we were talking
as well. Is there any situation where you don't use it, where you don't recommend this type of therapy?
Yeah, and it's funny that you mentioned the professional sports teams. A lot of athletic trainers and physical therapists and stuff will use laser therapy because it speeds wound healing. It gets those players back in action faster and that type of thing. And I've actually had laser therapy done on myself. We've actually got a little clip of a different type of professional athlete who you can see, the effect that a laser can have, because it's mentioned, okay, so you like shine this invisible laser on my dog and you can't feel anything and you can't see anything, and how does it work and is it going to work and that kind of thing. And it's important to know that it should take, it takes several treatments. So this little guy here is this little penguin who has a very sore leg, and it works on any species. That's as well. And so this is after about 9 treatments with the laser for him.
And he's just scrambling down
And
the
he
runway
says,
there.
"Let me loose, man. I'm ready to go." So that's just, and I love that video because it does show very appreciably the significant impact that it can have. But I also just crack up every time I see that little penguin go shooting across the floor.
Yeah, well, and we'll make sure we have that in the show notes.
Yeah, have it in the show notes.
There as well.
So you can see that.
Any other
So yes,
drawbacks?
so drawbacks, contraindications. One of the drawbacks to lasers, for as many good things as it has, is you do have to do it fairly often right at the beginning. So most of our patients will have every day or every other day, 3 times a week, kind of that scenario. So you got to make a lot of trips in. But that's okay because it's going to be working. And there is costs, of course, associated with doing laser. As far as the medical reasons to not use it, we don't use it when we have any active bleeding. So if we had a patient who's actively bleeding, we don't use it because it improves blood flow, and that's really not really where we want to go if we're leaking. So we don't use it for active bleeding. We also don't use it specifically over reproductive parts. So I wouldn't use it to heal, something on a scrotal area or something like that. There's not been any proven danger to that, but it just seems to sort of make sense, so we don't do it. But like our technician who is expecting, she can operate the laser and use it. We just don't laser the baby. But and the only other one that we really don't want to use it for is if we have an area that is a tumor, or if we have a surgery site that we don't know has clean margins after tumor removal, we won't use the laser. Because it does stimulate cellular growth, and we don't want to stimulate the wrong cells to grow.
Okay, so again, I guess the teaching point to come out of this is talk with your veterinarian and find out what range of care options there are if your pet is hurting.
That's right.
And going through things.
It's this is not one that a lot of people know about or hear about, and it's actually been around for quite a while, and it's very effective, and we can use it in a ton of places.
Yeah,
it's pretty cool.
Excellent. Well, don't forget that Dr. Wendy at RVNN's Pinterest account has an area where we'll have close-up pictures of the doggles, and
that's right,
and for cats as well. Don't forget to circle us on G Plus. Come by and say hello on Facebook, and some comments on the episode here.
Please.
Whether you've been able to have this sort of treatment for your pet. Don't forget also to follow us on Twitter. And when you're on Twitter, use the hashtag TFTR, Tales from the Road, for your questions and comments on the show. Thanks very much for joining us. We'll see you next time on Tales from the Road.
Hey, Gabe, wanna go for a walk? Gabe? Gabe? Gabe?
Hey, buddy, you lost? Hold on.
If your pet is the adventuresome type, be sure he's connected to PetHub. A quick scan using any smartphone shares your pet's vital information so that even his wildest escapades have a happy ending. PetHub, reuniting pets with their families.
Come on, Gabe, let's go home.